Imagine this. A child is born in a small village in Malaysia. She's beautiful, full of life, but she's also HIV positive. Not because of her choices, but because of circumstances beyond her control. At school, she's bullied. At the clinic, she's stared at. In the village, she's whispered about and avoided. She carries not just the virus, but the weight of rejection from society. Now, imagine if with just one decision, your decision, Mr. Arman, this child could receive care, counseling, and protection from discrimination. Imagine turning her life around. That is the power you hold. My name is Danish Idlan bin Zamani, and I'm going to present my persuasive speech about Malaysia AIDS Council. Mr. Arman, I work with the Malaysia AIDS Council, or for short, MAC, since 1992. We have stood at the front line in the battle against HIV and AIDS in Malaysia. We are an umbrella body uniting NGOs across the country who are working tirelessly to fight this epidemic. But let me clear, we are not just fighting a disease. We are fighting stigma, the cruel, invisible wall that isolates thousands of Malaysia. People lose jobs, children are thrown out of school, families disown loved ones. This is the everyday reality for those living with HIV. Let's look at the number. According to the Ministry of Health, Malaysia, over 87,000 people in our country live with HIV. Many are too poor, too scared, or too far away to access medical supports. In cities, people suffer in silence. In rural areas, the fear of being seen walking into a clinic keeps them from seeking help. First, we need to bring help to them, not expect them to come to us. That's why our mobile HIV screening program is so crucial. These are fully equipped vans that travel to cities, towns, and remote villages to offer free HIV testing, counseling, and support. Our staff do not judge. We serve with compassion and confidentiality. We recently visited a fishing village in Terengganu. An elderly man who had never been tested before broke down in tears after learning he was positive. He said, "If you had not come, I would have died not knowing. Now I can live and prepare. This is real, this is urgent, and this is where you come in. With your help, Mr. Arman, we can increase our outreach tenfold. We can reach places where even ambulances don't go. Your support can save life and restore dignity." Let's talk numbers, Mr. Arman. With 200,000 donation, you will fund 2 mobile HIV clinics for an entire year, support over 500 patients with free treatment, counseling, and medicine, enabling community outreach programs in high-risk areas, train dozens of new volunteers and healthcare workers, launch public education campaigns, and reduce fear and misunderstanding. And of course, you will be wondering, what do you will gain from it? What do you will gain from funding to us? Alright, I will tell you what you will gain, and you will not be disappointed, Mr. Arman. First, your company or you will be listed as a gold sponsor on our website, banners, and media campaign. You receive a tax exemption under Malaysian law. More importantly, you will be remembered as the CEO who stood up for humanity. When other CEO or others, the people who can help, stay silent, you won't just be writing a check, you'll be changing the narrative of HIV in Malaysia. Also, you will be changing your image, Mr. Arman. So today, I invite you to act. Not tomorrow, not next quarter, now. Let me remind you what we've discussed. First, I explained to you, the Malaysia AIDS Council is a credible, long-standing organization on the front line of HIV care. Second, our mobile screening program saves life, brings services to the forgotten corners of Malaysia. And also, the last one, your donation of 200,000 will bring hope, health, and dignity to hundreds, if not thousands, of Malaysia. I close with the words of Nelson Mandela. It always seems impossible until it is done. Mr. Arman, let us do the impossible together. Donate, partner with us, become a symbol of compassion in action. That's it from me, Mr. Arman. Thank you so much for listening my persuasive speech.